I'm a sport and exercise medicine physician and Professor of Sports Medicine at La Trobe University in Melbourne. I've been working with athletes of all sizes, shapes and abilities for 40 years, working with AFL clubs, Australian Olympic teams, the Socceroos and the Aussie cricket team, as well as a stint in the UK as Head of Sports Medicine at Liverpool Football Club. Tough gigs, but someone had to do it. So why am I here talking to you about diabetes? My father had type 2 diabetes, and I watched as he progressively suffered many of the typical complications. I was determined not to go down the same path. A few years ago, despite eating a so-called healthy, low-fat diet and exercising regularly, I was significantly overweight with high triglyceride and insulin levels, as well as suffering from a fatty liver. In other words, I was pre-diabetic. I decided to try a low-carb diet, reducing my intake of sugar and starches. After 3 months, the results were incredible. I reversed all my metabolic abnormalities, as well as losing 13 kilograms. I've maintained that way of eating ever since. Every blood test comes back absolutely normal, and I have no doubt that if I had not made those changes by now, I would have type 2 diabetes. As a result of my own experience and years of intense study of the relationship between diet and metabolic disease, I'm now passionate about the real food way of eating that focuses on healthy proteins and fats while limiting sugars and processed foods. Type 2 diabetes is a disease of carbohydrate intolerance. So it makes sense to control your diabetes by limiting your carbohydrate intake. That includes limiting not only sugars, but also starches, which are broken down to sugar in your body.